Well, welcome. We are in a very interesting location. It's very gorgeous, actually. We're actually in Tucson, Arizona, at an alternative therapeutic psychedelic conference where folks with different levels of experience in engaging in alternative therapeutic care are learning more about the practice. And today we have a special guest who I will let introduce herself.
Okay.
So if you could just tell us your name and your title.
Sure. So my name is Kiki King. Kiki's a nickname, but Kerry King is my licensed name.
Okay.
I'm a licensed professional counselor and also a licensed marriage and family therapist.
Okay.
I'm a certified sex addiction therapist, and I'm a GALA certified, which is equine assisted psychotherapy.
Oh, wow.
Yeah. So I'm a clinician here in Tucson.
I want to make a joke. I don't know if you ever combine the sex addiction with the horses in some ways, but
Unlike yeah.
Okay. All right.
We use a little humor in therapy for sure.
Real good.
Got to.
So this is a really unique group of folks that are coming from different perspectives, and I've met individuals that are into kinesiology and just really trying to apply different approaches to improving healthcare. I think all of us are at a point where we realize that our current healthcare delivery mechanisms have much to be improved. We could just look at the general efficacy rates in different patient populations, and they're not optimal. And certainly when we're referring to different types of classes of medications, they oftentimes carry intolerable side effects. Some of them are quite toxic, which eventually results in kidney and liver damage over time, and perhaps other types of negative effects. So, my initial question for you is, what brought you to this unique place among this unique group of folks?
Yeah, well, that's a great question. Really, the main reason I'm here is because this was patients seeking more information. So even though I'd heard a little buzz in the field, I've had patients come to me with questions about, have I heard about ketamine treatments? Have I heard about cannabis treatments? And what is my understanding of that? And they're seeking advice from me and encouragement and support, and they want to know. So for my own edification and for best patient care, it's really important for me to understand what is changing as far as how it is that we treat patients.
Sure. So you're hearing a voice of concern from the patients that are interested in trying something new. Mm-hmm. I'd imagine many of these patients have faced treatments that they just have found that are not effective, so they're still looking for continuous care and improvement and so forth. Thank you so much for taking it upon your shoulders to educate yourself in something that is sometimes a little risque still, right? So I know I face a whole lot of backlash with regard to even my pursuit of promoting the benefits and also noting the objective risks of cannabis use in scientific and academic communities. It's very real in my world, the stigma and the pressure, the peer pressure, quite frankly. Do you think that there is a similar type of stigma out there for folks in your position that may be in your position that are open-minded to alternative care?
Yeah, I think that not only are my patients curious, but I'm also curious because I see the same level of stuckness and constantly looking for different modalities. But there's certainly stigma around certain approaches versus other approaches. I think anytime something is new, people come with a healthy level of skepticism. But part of what we're talking about here is not new. In fact, it's ancient treatments and been very successful in past. And so that part I think has been minimalized for a long time, certainly since the 70s for sure, right?
Sure.
So I think it's important to look at what is working and what isn't, and then be open to the new science that possibly supports something that's been around for eons.
Sure. And what we're hearing over the past couple of days are these profound experiences, obviously, that people tend to endure when they engage in psychedelic medication use. And that's quite different than conventional therapies, which are intended to be more subtle, I believe, right? And oftentimes they take a while, sometimes weeks or even months to really take full effect, and then it's supposed to alter our visceral sensations so that we have more elevated mood, but not too high, because Lord forbid anybody being too happy on earth. But this is a real departure from conventional therapeutic, I guess, expectations, because the expectation here is for the individual to experience a profound psychological experience in a relatively short amount of time in ways that kind of shift their thinking.
Mm-hmm. Yeah, I think a relatively short amount of time. I think some of the treatment protocols we've been talking about are mostly 3 months, around 3 months. And also we're talking about really responsible dosing. So what's very different from the traditional medical model, I find, is typically when you're prescribing something like Xanax or Paxil, it doesn't come concurrent with a prescription to do talk psychotherapy, right? So the modalities that we're talking about here are unique in the fact that the side effects are limited. It can be intense in experience, but it's short term and it's done really responsibly, so that there's a pre, during, and post procedure that accompanies recommended dosages of things that we know to have potentially less side effects than some of the pharmaceuticals that we see.
Sure.
Yeah,
and
so that's powerful for me.
It's all about. It's about
Right.
the relative risks
Right.
and benefits. And in terms of side effects, we're talking about long-term consequences of use. For many, at least natural psychedelics, right? And that's sort of different than the types of profile side effects that we find with conventional medications. So when you're actually during the experience, there is quite aversive reactions that can take place. People can become shocked, experience extreme trauma, and sometimes elation, and just oftentimes will, if it's a profound experience, will not know what the heck's going on around them.
Right.
So have you heard of how those types of experiences ultimately tend to shift folks that might be a little bit stuck? Or what have you heard from your patients with regard to maybe how their use of those medications has altered their canalization and feelings of depression or anxiety?
Yeah, so I don't have any patients currently on any psychedelics. None of the patients that I've had thus far have been able to benefit from those practices because they're so new. And so information that I have had is anecdotal, with the exception of cannabis, of course.
Okay.
So, and then understandably, I have some patients that shouldn't be tolerating cannabis. And those are the patients that are going to use it in an abusive way. But I have other patients that have reported benefits from cannabis.
Okay.
And that would be in a reduction of anxiety, feeling connected, a part of ritual, but mostly to manage medical issues and or anxiety. That's when I see it used the most, and I've seen it have beneficial effects that way. So
sure. And I don't know, I guess I'm just wondering with regard to, I guess, the more powerful plants in psychedelics. So some folks describe cannabis as along the continuum of psychedelics, and certainly peak effects of cannabis use are sort of similar to initial stages of psychedelic experiences. And I forgot where I was going to go, so I'm definitely going to
somewhere with the benefits of it and the profound experience. Is that what you're
so that's what I wanted to ask you about. So you have intense education on different therapeutic approaches, and I guess probably how patients tend to think about themselves, their trauma, and so forth at different stages of recovery. Whereas I'm just more of a basic scientist. I've never been educated in terms of dyadic therapeutic approaches and so forth. But I'm just wondering how these profound, oftentimes terrific, terrifying sometimes experiences might cause people to kind of shift out of these modalities of depression, for example. So there's a lot of conversations about sexual trauma that I've heard many folks discuss, oftentimes comes up during these experiences. And I'm wondering how the exposure or the revisiting of those really intense aversive memories is helpful for folks.
So my understanding at this point, talking with other professionals, doctors and clinicians, is that part of what becomes accessible is the ability to recall it without being as close to it. So I guess my understanding is it's almost like observing the event, maybe decreasing inhibitions, breaking down the ego a little bit to be able to observe the experience without actually recalling the specific experience as in being in it with such intensity. And what would happen in that state is that you would be in a more calm state, and you would be able to observe the experience almost as like a third party, right? And so then that gives you the ability to restory it, right? Observe what happens and be a little bit apart from the story, and perhaps reauthor it, and get some takeaways that you didn't have before. So I think that's pretty profound, and we see that with other modalities in things like EMDR can be really helpful for that. Eye movement desensitization and reprocessing is really good for that. Somatic work can be really good for that. But oftentimes people are hesitant or unable to get close to the trauma, or you can physically feel or see a shift in them when they start speaking about traumatic events for whatever reason, like toxic shame is so present, or it takes them into a different state where you can see physical reactions. I've seen trembling, I've seen shaking, I've seen people that have in one state left their body, right? And so this could be a way for them to get to that place where the trauma occurred, and in a safer way, potentially. So that can be really powerful for people.
So
right?
just kind of taking them out of that moment, seeing it in kind of a broader context, where obviously there's still victimization, but perhaps one is not looking through the direct eyes of that lens.
Yeah, it's a present experience, right? Because where the body stores that experience, it feels to, and the brain thinks that, and the body feels that they are back in that experience. So if you can imagine going back to a trauma that happened at 3 or 4 years old, the body doesn't know whether or not it's actually happening or whether it's being remembered. So this is a way to, I think, use a filter, right? And go, this isn't happening to me, but this happened to me, right? So there's a difference. And you know, we've all felt it, like when you are going along and all of a sudden you're like, oh, wow, that feels really intense, right? Perhaps there was like a traumatic trigger or something like that, and you can kind of feel it in the body. So that can be really difficult for people that are trying to avoid that. So other modalities can be helpful for accessing that, but I see a lot of potential with this as a safer way to have a profound shift in a potentially shorter period of time.
Okay, so you're mentioning a class of, or a population of patients that this intense third-person experience might be particularly helpful for. In addition to folks that have experienced sexual trauma, do you think that other types of patients might be particularly benefited by these alternative forms of therapy? Yeah,
I think what I see a lot, you probably have seen this too, even as a scientist, right? But just as being a human being, I think that people are feeling like I see a lot of people feeling emotionally bankrupt, or just feeling spiritually lost, and just are hurting, right? And maybe they don't even know how to describe it or put words with it. It manifests as depression, it manifests as anxiety, and maybe it's just that they're feeling lost and purposeless, right? So I see an opportunity there too to kind of explore and experience like what is it that I'm here for, and what is my purpose, and what is my reason, and sometimes we have to get out of ourselves, I think, a little bit, right, in order to do that. So I see this for the potential, right, for a broader base, right? So potentially people that are struggling with emotional difficulties, mood disorders, not in addition to trauma.
Sometimes I go through very strange moods, but I describe the same thing. I just see many of us suffering, not only from these expectations and this kind of artificial reality that we live in, when we're expected to be outside of our home, away from our friends and family for 8-10 hours a day, and oftentimes we're not in control of our time or money or any of that.
Right.
We're not oftentimes even near our loved ones anymore, somewhere.
Yeah, and we often don't have the time, the discretionary time to sit around and think about, what is the purpose, right? Those existential questions that maybe at one time we did. So I'm not exactly sure for me how that I'll use this, but I just know that it would be neglectful for me not to explore the opportunities for my patients to have greater healing.
I love to hear you say that, because that just goes to show that you're in it to win it for the right reasons, and you went in it to help people, and you continue to fight to do so.
Yeah, it's a good fight.
Thank you. Thank you so
you're
much.
welcome.
It was very nice to meet you. I don't know
Nice
if there's
to meet
anything
you.
else you would like to say to folks that might be in a similar position of maybe entertaining alternative care within their practice, or perhaps for patients that just might be hearing some of this stuff for the first time.
Yeah, I guess my big takeaway is that there are many people that are seeking and that are hurting, right? And there is no quick fix, no matter what it is. There is no pill. There is no one way to have a cure-all or an answer. But I do think it's important that we're seeking for good solutions, and that we're not alone in that process, right? So that in and of itself brings us together, and it's important, right?
That's what I love about all this, including cannabis, is
Yeah.
I think it really enhances this sense of humanitarianism and
Right.
connectedness.
Right.
And ultimately, we're all in this world together,
Right.
so we need to look after each other.
Right, yeah, there's no, it doesn't matter how much you make or how little you make, right? Hurting is hurting, and healing should be accessible to everybody.
That's beautiful.
Mm-hmm.
Thank you.
You're welcome. Yeah, my pleasure.
All right.
Thanks. Baby, you got something?
We hope it helps.
Yeah, okay. Well, good luck.
We hope it helps.
All right, should we get some more learning on?
Let's do it.